Yes, welcome back to this channel. Welcome, good morning, good evening, good night, depending on the time you're watching this video. In today's class, we're going to be diving into the second topic in this course, the use of national standing orders for community health practitioners. In this chapter 2 or topic 2, we are going to be looking at the layout of the standing orders. So by the end of this class, you should be able to understand the way the standing order has been laid out, the way it has been structured or organized. Okay, the essence of this class is to enable you to seamlessly and efficiently navigate the standing orders. If you understand this class very well, after this class, you should be able to, within the shortest time possible, locate whatever it is you need to locate in the standing orders. So get ready with a pen and paper. As we dive into this class, make sure you put down relevant notes. Okay, do not forget to subscribe to this channel, share this lecture with your co-students. They may have one or two things to learn there. They will definitely have something to learn. Promote the channel. Let's grow together. Let's go together.
Right.
Okay.
All right. Now we are right inside. Okay. We are right inside. Okay. Like I told you before, we are going to be looking at the second topic in this course, and the topic is titled "The Layout and Format of the Standing Orders." And at the end of this lesson, generally, you are expected to be able to identify and describe the key components, arrangement, and sectional division of the standing orders for effective use in daily practice. This chapter is aimed at getting you acquainted with what is where in the standing orders. It is aimed at enhancing your efficiency, your ability to navigate the standing orders and get what you want very, very efficiently. Okay, over time, for some years now, you see that some students under examination spend the whole time trying to locate the case in the standing orders. It's because they have a poor mastery of the layout and the format of the standing orders. So today, by the end of this topic, by the end of this lesson, you should be able to avoid such a problem. You should be able to quickly navigate through the standing orders and get whatever you want to get as quickly as possible. All right. So the standing orders are like we established during the definition. They are structured. Okay, they are structured document. They are carefully arranged. We know that is no longer in use. And then the essence of the arrangement, the essence of the layout, the essence of the structuring of the standing order is to make information easy to find and apply during patient care. So your ability to understand the component of the standing orders helps you to navigate the standing order very, very efficiently. Okay. In order to do that very well, in order to be able to understand the way the standing order has been sectioned, has been arranged, has been designed, I try to make this table, and then this table will give it all to us in a nutshell. You can see from the first part of the table, the title is a component, and then the second part in the middle, you see description. Okay, what you find, what is obtainable, you know, under such a component, and then the last part of it titled the purpose or the function, what it serves. Okay, so we are going to be looking at the sections of the standing orders or the component of the standing order, better to use component of the standing order. Then we try to describe it and we try to see what it is intended to offer us. Okay, so the acknowledgement part is the first component of the standing order, and what you get there is just a list of the editors, the contributors, and the approving authorities. That is what you get in the acknowledgement component of the standing orders. And the essence of this component of the standing orders is to show the authenticity, and the source of the document. The more you know about who made the standing orders and who approved the standing orders, the more you are likened to respect it. Okay, if you really don't know where it's coming from and who is coming from and who is approving it, you may treat it with less regard. Okay, so the acknowledgement section of it or component of it, you know, exposes you to those who are behind these standard orders, and then it will enable you to figure out how authentic this thing is and where it's coming from, and that will make you to respect it the more. The second component of it is a preface or the foreword of the standard orders. And then what you see here is a background on why the standard orders were being developed or revised. Okay, so it gives a kind of overview why the need for the standing orders. And what it serves is to introduce the context and objective to you, the reader. So before you go into the standing order, you already have the context of the standing order and what the standing order intends to offer. So with that in mind, you'll be clearly defined and directed, okay? And then the next component you see is a table of context. And what you see there is a list of major sections and page references of the standing orders. And what it does for you under the function or purpose here is to enable you to quickly navigate the standing order, quickly navigate whatever it is you want here, navigate, look for it, locate it, okay? The table of content does that. Then the next component is the abbreviation or the glossary. And what you find here is short words, abbreviations, acronyms, and their full meanings. And the purpose of this component is to promote clarity and then standard interpretation. The more you get yourself acquainted with this component of the standard order, the more you are able to be clear with the standard order, and the more you are able to give appropriate and accurate interpretations. Okay, and then you get to the general introduction of the standard orders. That is the next component. And what you see there is the explanation of the scope and the purpose and how to use the standard orders. So this component of the standard order tells you the scope of the standing order, where it's beginning and where it's ending. Okay, the scope, the boundary of the standing order, and it tells you the purpose and how to use the standing order. So what you get there, the function it offers is guide. It gives guide to new users in the correct application. You may be handling the standing order for the first time. So in order to have an idea of how to use the standing orders, you need to go to the general introduction component of the standing order. Okay, even as a regular user, not a new user, if you get some doubt on how to navigate the standing order, you make your way to this general instruction in order to get guided on the correct application of the standing orders. Then, after the general introduction, you see introduction to the users. What you see there is outline, principles, ethical limits, and then general responsibilities. And what it offers, the function is to ensure safe and lawful practice. Safe and lawful practice. Very, very, very important. Then you get to the next section, the next component, which is the main body or the case section, the cases section. And what you see there really is the core content, okay, of the standard orders arranged according to the age group, according to the disease conditions, and then according to the findings and clinical judgments and actions. So that is what you get to find in the main body or the case sections of the standing orders. What it does actually is to direct step by step clinical, actions, what to do at what time, how to arrive at a diagnosis, what to do as a clinical action. So this is what this component of the standing orders does. Then you get to the appendix of the standing order, or you call it the job aid. What you see in this section of the standing order, you see chart, you see tables, you see syndromic management guides. Okay, and then what this component does is to provide a quick visual reference during care. Quick visual reference during care. Okay, you see job aid. You know what job aids are. If you don't know, it's going to be one of the topic we look at before the end of this course. And then the last component of the standard orders we're going to get here is the index. The index is just the alphabetical arrangement of the things inside the standard orders. The purpose of it is to make it easy for you to locate specific topics or specific concepts. When you just go to the index, you are looking for um pathograph, just go to the index, you see pathograph, and it tells you the page where you find it. You open it there, and then you easily do whatever you want to do. Okay. All right. I want to emphasize few things here. I want to make few emphasis, very very important. Okay. Emphasis number one from the first bullet here, you see every component serves a specific function. Okay. Every component of the standard order serves a specific function. Skipping any one may lead to misinterpretation. So you are expected to get yourself acquainted with every component of the standard order from the preface down, 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 down to the um, appendage, right? You need to get yourself acquainted. Every of those components serve specific function. So do well not to skip any. You may be misinterpreting a lot of things if you are not acquainted with all the components of the standard orders. Okay. Emphasis number two: the standard orders are not just medical notes. Okay, they are legally binding operational manual. Okay, it serves two purposes: one, clinical accuracy, clinical guide; two, legal cover for both the patient and the healthcare provider. It ensures that you are not going outside a legally permitted scope based on your level of training. Okay, so it's not just a medical, manual. It's also legally operational manual. So you don't joke with it. Whatever you do outside the standard orders, you know, binds you legally, makes you legally liable. Okay, so the last emphasis I want to strike here is that practitioners should familiarize themselves with the layout during training before applying it in the field. That is why we are making this emphasis now. However, even after training, standard order is supposed to be your companion. Okay, let's go. So let's see the various sections of the standing orders by age group. Okay, like we already established before now, the standing orders are divided into major sections according to age groups and medical conditions or diseases. Okay, which you can also refer to as service area. This arrangement help the practitioners to locate guidance relevant to specific clients from the newborn to the older. You see 8 sections. Okay, let's remove the managerial sections. 7 clinical sections. Okay, based on age group and based on the disease the person is presenting. One of these sections, sometimes two, may be necessary to be combined to get to identify what the problem of the patient is and provide solution to his or her problem. So let's see this one by one. I try to get this done through this table. You can see the table is titled sectional division of the standard order CHO edition. Okay, then you see the sections here from 1 to 8, and then you see the client group. Okay, the age group we talked about. We say this according to age group and then disease conditions. Okay, so it is when you get the age group of your patient or client that you now navigate to get the condition of such a person under the category for his age. Okay, so you see the sections 1, 2, 3, 4 down to 8, and then the appendix, and then you see the client, the group of client, the age group of the client. and you see example of the conditions that can be covered there. So at the end of this table, you should be already have this, component of the standing order at the fingertips. Okay, you should be able to go to anywhere in the standing order, get what you want, depending on the age of the person you want to care for. Okay, so you see section one here, and it's for newborn, 0 to 28 days. Okay, example of cases that are covered here include bed asphyxia, sepsis, jaundice, umbilical cord infection, and the rest of them. Okay, so the moment a child is brought, a newborn is brought, a baby under the age of 28 days, you have no business with any other section except the section one. Okay, after that, you get to the section two, which is titled the early childhood between 1 month and 5 years. Okay, it's no longer a newborn. Okay, it's no longer a newborn. It has gone beyond the age categorization for a newborn. You see cases like malaria, diarrhea, cough, ear infection, and the rest of them. And then you see section 3, middle childhood, beginning from the age of 6 to 12 years. Okay, and then you can see fever, respiratory infection, you can see injury, sexually transmitted infection, and the rest of them. Then you see section 4, which is a unique section, Okay, it is adolescents for age group of 10 to 19. I call it a unique section because the conditions you see here are adolescent peculiar cases. You will never see anything like, now, something is worth paying careful attention here. Look at the section before the adolescent section is for people between the age group of 6 to 12. Now you can see that the adolescent section is for people between the age group of 10 to 19. You should be seeing what I'm seeing at the moment, that the adolescent section also covers the age range for the section before the adolescent section. For example, somebody is 10 years, is 11 years, is 12 years, and then is still an adolescent and still falls within the categorization for section 3, which is middle adulthood. So when such a person present a case, where do you locate? Do you go to section 4 or section 3? It depends on the condition the person is presenting. And remember, I said the adolescent section is adolescent peculiar cases. You only see adolescent related or special cases there. You're not going to see a case like fever in the adolescent section, or respiratory infection or injury. You are not going to see that, okay, in the adolescent section. Okay, so imagine that a child of, not a child, okay, a patient or a client of 12 years reports with a case of fever. You still go to section 3, even though they said it's 12 years. But when they say a person of 10 years, reported to you with uh, intention of finding out more about, okay, let's say the person is a girl, she's 12 years old, and then she's not comfortable with her breast size, she feels it's too big. It's a special adolescent case, it's an adolescent peculiar case. You cannot see that here in section 3, even though the age bracket covers her age. Okay, but it's a case that you only find under adolescent case because it is only adolescent peculiar. Okay, okay. If someone of 11 years also come with concerns about puberty, with concerns about contraception choices, okay, somebody that is sexually harassed or assaulted at the age of 12, 11, you don't go and manage that in section 3. You will not find that there. You have to come to the adolescent section. So I want you to understand that the adolescent section is adolescent peculiar section. What is peculiar about adolescents? Their concerns about puberty, their choices of contraception, their inclination to substance abuse, and all that. So you only see such special conditions in section 4. All right, let's go further. You now see section 5, which is for adults. You see fever, cough, difficulty in breathing, and the rest of them. Section 6, maternal health. You see antenatal care, labor, postpartum care, family planning, fertility, and then the rest of them. You see section 7, geriatric, okay, for older people. You are going to see conditions like hypertension, arthritis, diabetes, visual problem, and the rest of them there. Section 8, health facility management. We are going to see things like the concept, the definition, the principles, the functions of management, and the rest of them. And the last part you're going to see is not really a section, okay? Because it's not, it's a section, okay? It's a section. Just that it's not called section 9, okay? But it is called the appendix, right? You're going to see job is there and standard operational procedure, okay? So I advise you to take time, go through this table, see what is where in the standing orders, and that will enhance your ability to navigate the standing order to locate whatever it is you are looking for in the standing orders. By way of conclusion, okay, the standing orders contain several components that guide the reader or the user from the introduction to the action. Okay, first thing to note, sections are arranged by age group and disease conditions for ease of reference. Okay, mastering the layout ensures accurate and timely application in client care. Mastering the layout. If you don't succeed in getting yourself acquainted with the layout of the standard order, you will struggle to be very, very efficient in the application of the standard order in the clinical practice. You must you must get used to it like your Bible. If they say Matthew, you know how to get it. If they say John, you know how to get it. So you must get used to the layout of the standard orders. Okay? It will enhance your efficiency in the application of the standing orders. You can test yourself, evaluation questions. At the end, by this moment, are you able to list any three, four, five components of the standing orders? If you're not, then you've not achieved the aim of this lesson. Watch this video over and over again. Okay? This evaluation question to know how far you've learned. Okay? Questions like list any five main components of the standing orders. If you're not able to do that now, then you have not really achieved the aim of this lesson. You listen to it over and over and over again. You can play and replay. All right. By this time, you should also be able to explain the purpose of this standing order. The purpose, okay. The object. If you are yet to be able to explain the purpose of the layout, then you may be lost. You need to watch over and over again. You should also be able by now to outline the major sections of the standing orders on the client age group. Okay, you should be able by now to outline the major sections of the standing orders from the section 1 to 2 to 3 to 4 and the age group each of them is used for. You should be able to establish why it is important to understand the layout of the standing orders by now. If you have not, kindly revisit the video and watch it over and over and over. Okay? Kindly subscribe to this channel, click on the notification bell so that next time we come up with this kind of video lesson, you get notified. Subscribing is free. Just click that button and become part of this community. Join the channel, share our content to reach other audience, tell them to subscribe to the channel. Okay, it's free, it doesn't cost you anything to subscribe. Okay, subscribe now, do it now. All right, thank you. Whatever question you have in the comment section, I will make out time to see all of them and then respond to them. Feel free, whatever question you have, put it down in the comment section. I will respond to the question. I want to believe you are done with this lesson. See you in the next video lesson. Bye.